Happy New Year, everyone. I'm Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. Well, the holiday madness is now over. You're sitting back, you're planning on 2023. What's everybody's New Year's resolution? This week, we're going to be talking to you about strategies so that you can start your New Year's off right, healthy, and more pain-free. You're not going to want to miss this one, so stay tuned, everyone. Okay, Dr. Mike, the holiday season has finally come to an end. You know, I find myself in this position every year. Last year we talked about the same thing. Now it's time to talk about our New Year's resolutions, and on everyone's New Year's resolution, health and wellness, getting back into shape, eating correctly is always on the top of the list. So I talked maybe a few weeks ago about something that our son Ainsley and I are doing. We met a great guy, Kevin Plouffe from 4K Fitness and Nutrition, met with Dr. Marciello and I, has taken Ainsley and I kind of under his wing, and he's doing some personal training and some nutritional counseling with us. I'm starting to feel really good. It's kind of a nice way to, start the year off correctly and seeing the benefits. But I've noticed too, we've talked in the past, I got this crazy OCD, obsession with now just, working out every day. So I got over a 3-year streak going. And when I met with Kevin, I was shocked. I hadn't been on the scale in a long time. I'm at the heaviest weight that I've been, and I've run every day for 3 years in a row. So one of the things that you talked about and Kevin brought to my attention, at my age, at 50, it's really important to, talk about adding, active resistant exercises into my routine. And then in terms of my diet, I was shocked with the number of carbohydrates that I was taking in, even trying to be conscious about eating healthier and increasing my protein. So what are some of the strategies that we can look at to kicking off the new year correctly?
Well, I think, again, the concept is it's not just simple. People go into the idea of, I'm going to lose weight, okay, I'm going on a diet, I have to get my health and nutrition under control, therefore I'm going to lose weight. For some people that works okay, but many times it's this combination of things, of what food you're eating, what exercise you're doing, what are you trying to get back to, what your goals are. So it's not just always the same cookie cutter, do this process and you'll be fine.
Yeah.
So one thing, as you just mentioned, if you don't build up muscle, if you don't increase your body's baseline metabolic rate to burn calories, you may actually train all you want and really not lose much weight. Yeah. So there's a dietary control, but sometimes we actually have to exercise differently. It's not just cardiovascular only, but if we mix it up and we get that assessment for that person, what they do for work, what their ages are, as you mentioned, what a person does in their movement and the aspects of work activities or not, those are all important kind of elements to why someone may lose more weight or not. But remember, it's not just losing weight. It really is to become more physically fit, better in your general health condition. And we want to look at all those pieces, because if you've got something that ails you and preventing you from doing things, sometimes it's not just so easy just to go ahead and put on the sneakers and go for a run, so to speak.
Absolutely. I love the fact that he's taken Ainsley on as well. It's, if I look back, you and I, freshmen in high school, if we had any coaching where we could work on our physical fitness and nutrition, boy, that would be fantastic. But I also say to our patients, meeting with you too, a lot of the, conditions that come into the office with patients with chronic pain, you have the time to sit with them and talk to them about, more anti-inflammatory diets and, eating cleaner and looking at more plant-based sources for their foods. And that makes a big difference overall.
It really does. And so when we start breaking it down from the health and wellness component, and we're not just looking for weight loss, the concept is if you eat more clean or more healthy, like you say, we put more plant-based foods in our, good old fruits and vegetables, if you will.
Yep.
That actually makes the body feel better. People who have sensitivities commonly to dairy products, to high gluten or added sugars, the body feels more uncomfortable. And that's where people think, okay, it's just carbs, it's just carbohydrates. But reality is sometimes it's all the gluten that's in the bread products that actually affect the body's joints. It is an inflammatory process for your body to eliminate all those things that you're taking in, and the joints feel more uncomfortable, more stiff, more achy. So by making those dietary changes, you actually have not only feeling better, your joints actually are less inflamed and actually feel better. So it can motivate you to go actually and do some of those exercises you hope to do for the new year.
Right, and I've noticed a huge difference too. I'm kind of, just off the tail end of the holidays, so there were a lot of snacks available. We got wonderful patients that bring us in baked goods, and there's just no way I can just walk away from that. So, and I noticed too, the cleaner I'm eating, the more plant-based foods I'm choosing, my body's responding to that, and that's the motivation as well.
Yeah. And it really does. It's a kind of a whole behavioral type of program we call a lifestyle change. It's a lifestyle medicine aspect of looking at the idea of how do we behaviorally change our mechanics and aspects of what we do, so we choose better for foods, better things to do. We actually sleep better. We actually look at ergonomics and actually maintain exercise and movements and things. All those things and what we can control ourselves really can make a huge difference. And we really just have to get ourselves in order. And people usually, again, this New Year time, get motivated in the last 3 weeks, 6 weeks, even 3 months, or sometimes there are people doing really well and then they tend to fall off. So we want to make it a long, sustainable program, not just for that, New Year's resolution that lasts you only for a month.
Right, and I would recommend strongly that kick the new year off right. Come in and make an appointment to see Dr. Marciello. He's going to look at you from head to toe, inside and out. He's going to point out, a lot of the things that, you'll benefit from treatment from. We're unique in that we've combined the medical care, chiropractic treatment, and physical therapy all under one roof, so we can address everything all in one office setting. If you'd like more information about our wonderful practice, you can definitely get information on our website at maragalmedical.com. We have a library of YouTube videos that you can also look at for different specific conditions that will also give you that important information as well. And best yet, you take most insurances. So folks, let's kick off this 2023 right. Make an appointment today at Maragal Medical. That's it for today. I hope you enjoyed the holiday season. Let's start things off right. We'll see you soon.
Have a great New Year.